Welcome to This Explainer. Today we're unpacking a really fascinating, kind of surprising paradox in the medical world. Imagine walking into a clinic, right? The waiting room is absolutely packed, the doctors are seeing, 30 patients a day, the staff looks incredibly busy, and yet, they're literally struggling to keep the lights on. I mean, how is that even possible? Well, today we're exploring the hidden cost of handoffs and uncovering exactly why busy practices go broke. It's the exact question keeping countless clinic owners awake at night. Why do busy medical practices still run out of money? We all naturally assume that if a doctor is great at medicine, the business is just going to thrive. But here's the harsh reality we have to face. World-class clinical skills, they do not guarantee a practice's financial survival. You can literally be the best clinician in your entire city and still not be able to make payroll. Crazy, right? Okay, let's dive into this with a stark comparison. First, we have excellent clinical care. This is the heroic stuff. Accurate diagnoses, caring providers, truly life-changing therapy. But competing directly with that is the chaotic reality of failing practice operations. We're talking unanswered phones, unpaid claims sitting around for months, and massive staff burnout. The clinical care isn't the problem. It's the broken back office dragging the whole ship down. Consider this hard truth straight from our source material. Most medical practices that struggle fail because of bad operations. Think about it from the patient's perspective for a second. Most patients can't medically evaluate if you made the exact right diagnosis, but they absolutely judge the operational experience. Was it easy to book an appointment? Were they seen on time? Did the billing actually make sense? That experience is what sticks with them. So, the absolutely crucial point here is that we have to reframe how we view the administrative side of a clinic. It's not just boring paperwork, it's the invisible engine of healthcare operations. This engine runs underneath the medicine. When it works, it protects both your patient outcomes and the financial health of the practice. It's the very system that allows a talented, individual clinician to function as a reliable, scalable organization. Section 1. The Patient Journey Relay. Think of healthcare operations as a massive relay race. Delivering care isn't a solo sprint. It requires multiple departments to pass the baton stage by stage without dropping it. Here we see the pre-visit stages of that journey. It starts with discovery, when the patient first finds you. Then scheduling, to book the visit. Next is verification, where staff confirm insurance coverage. And finally, registration, where vital data is collected. Notice how every single step sets up the momentum for the next? If the scheduling is chaotic, the verification team is rushing. If the front desk enters just one wrong digit during registration, you're already set up to fail later. Next up, we hit the middle stages: intake, the clinical visit, and documentation. Look really closely at this sequence. The clinical visit, the actual face-to-face time with the doctor, is just one single step surrounded by all these vital operational tasks. If intake forms aren't done before the visit, the provider basically walks in blind. If the documentation isn't finished promptly after the visit, well, that amazing clinical care can't be translated into revenue. And that brings us to the post-visit stages: billing, claims, denials, and retention. This is the final financial stretch of our relay. The care has already been delivered, but if you drop the baton here, say by submitting a claim with a tiny error or just ignoring a denial, the money simply evaporates. Poof, gone. And if there's no system for patient retention, folks who need follow-ups just fall through the cracks, which hurts both their health and your revenue. Section 2, where the baton drops. So we've seen the ideal relay race, but, care rarely fails because one runner is slow. It fails when the baton is fumbled between departments. Here are some of the most dangerous yet super common handoff failures. Skipping insurance verification because staff feel rushed. Typos during registration. Providers doing pajama time charting at 10 p.m. because they didn't document during the day. And a massive one, the front desk and billing departments just not communicating. A simple misspelled name at the front desk registration will bounce a perfectly clean claim weeks later in the billing department. Which brings us to a really crucial rule of thumb: 48 to 72. That is the number of hours before every single visit that insurance eligibility must be verified. And I mean every visit, not just new patients. A returning patient you've seen for years might have lost their job or switched plans. Catching this 48 to 72 hours early prevents a massive, expensive downstream failure where you end up providing care for free. Section 3. The silent revenue leaks. When we think of a business losing money, we usually picture these loud, explosive financial disasters, right? But in healthcare operations, revenue loss actually happens through silent, invisible leaks that slowly and quietly drain a practice dry. To understand these leaks, we first have to define the revenue cycle. It is the entire journey of a dollar, from the moment before a patient even walks in the door until the moment payment is fully collected in your bank account. A lot of folks confuse billing with the revenue cycle, but as our source beautifully puts it, billing is just one small chapter, while the revenue cycle is the entire book. So where does the money leak out of this cycle? Well, here is where money quietly dies. Unverified eligibility, meaning you treated someone whose plan was inactive. Mischarge captures. This is literally care you gave away for free because nobody bothered to enter it into the system. And unworked denied claims. The insurance denies a claim, it sits untouched because everyone is too busy, the strict timely filing window closes, and yup, that money is lost forever. Section 4. Fixing your broken handoffs. All right, we've diagnosed the illness, the dropped batons and silent leaks, and now it's time for the cure. How do we permanently plug these leaks and ensure the invisible engine runs smoothly? And this brilliantly illustrates where to start, right here, with standard operating procedures, or SOPs. An SOP is simply a written, step-by-step description of how a specific task is done. This is vital. Relying on processes that are trapped in one veteran employee's head is a guaranteed recipe for chaos the second they get sick or leave the practice. You have to turn that head knowledge into a system the whole practice can rely on. Next, consider task ownership. You must assign unambiguous single ownership to every critical task. If you ask, hey, who works denied claims? And the answer is, oh, we all pitch in as a team. Yeah, you're in trouble. In operations, everyone is responsible almost always means no one is responsible. Tasks just quietly disappear when ownership is shared. One task, one owner. Simple as that. Now, once you have owners, you need to track success. But please don't drown in data. 5 to 7 is the magic number here. Leadership should track just 5 to 7 key performance indicators, things like your denial rate or the days a claim sits in accounts receivable. Review this small dashboard on a fixed rhythm. A few numbers watched consistently will always beat 50 numbers watched never. And this brings us to the 3 pillars of operational excellence: clear ownership, written process, and honest measurement. If you establish these core habits, you align your entire team. You give them a workplace that actually makes sense, instead of a chaotic environment that just burns them out. By mastering these 3 pillars, you ensure the handoffs are smooth, and the baton is never dropped again. I'm going to leave you with this final, provocative question to reflect on. In your organization, who is picking up the dropped batons? Is it your most expensive clinicians? Is it you, working until midnight? Or is the baton simply lying on the track while the revenue evaporates? Take a hard look at your handoffs today, because fixing them is the true key to unlocking your practice's potential. Thanks so much for joining us for this explainer, and keep learning.